we have had a number of sad days here since the coronavirus has hit this country, but this is one of the saddest. This weekend, we lost 5-year-old Skylar Herbert, who was a real daughter of the city of Detroit. Her mom, Vonnie, is a police officer. Her father, Ebby, is a firefighter. People whose entire lives were built around building the city. And Hakeem Berry, our chief operating officer, who's been at the center of this city's fight against the coronavirus. Hakeem and his wife, Tanya, are two of the Herbert's oldest and closest friends. And I talked to Vonnie Herbert this morning, Skylar's mom. He said that Skylar considered Hakeem her uncle. And he's been sharing with us stories about how bright and personable and funny Skylar was. And I asked Hakeem if he wanted to come here and share those stories, and he said maybe in a day or two he could do that. But it's a reminder to all of us what's at stake with our commitment to social distancing. And I want the Herbert family to know that they're being held in the hearts of all Detroiters today. Skylar was one of 47 we've lost in the last 3 days. For those who are keeping track of statistics, that is a number that's down significantly. But as I've talked about before, I don't put a lot of stock in weekend numbers. Literally, the person at the hospital who's supposed to fill in the reports may not be working on the weekends. So the numbers are heading the right direction, but we're not going to draw any conclusion on a Monday. We'll see how things look on Tuesday or Wednesday. But again, the hospitals are confirming to me their patient volumes are down. And over at the TCF Center, where they had 21 beds occupied on Friday, today they have 19 beds. So even the patients at the TCF Field Hospital are starting to go home. So the progress is great, but we're at a dangerous time. If you look at the pattern in other countries, we have dramatically bent the curve. Dr. Birx talked about it nationally on Saturday at the president's briefing. But every place in the world where people started to pat themselves on the back and said, this is under control, we can relax, they've seen a significant spike. And we just can't afford that here in the city. The thing that continues to be adding to the heartbreak is what's going on in the nursing homes. We're now up to 119 nursing home deaths. And I wouldn't be at all surprised when the final chapter on the coronavirus is written in Detroit if 1 out of 4 or 1 out of 5 of all of our victims were nursing home patients. What Denise Fair and Dr. Rahman and Henry Ford and Wayne State have done at the nursing homes in the last 10 days has been phenomenal. They have tested more than 1,000 nursing home patients with the 50-minute tests. They will be through every nursing home patient in this city by Thursday. We've been delivering personal protection equipment to all of the nursing homes, to the staff that were in short supply. We're running about 28, 29% of all of the nursing home patients we test are positive. And probably the most troubling thing is those without symptoms are testing positive at almost as high a rate as those with symptoms. And so people in the nursing homes, patients in the nursing homes that looked healthy, had the infection, were spreading it to others. Now with the 50-minute test, they're being properly isolated, and we're giving the nursing homes the tools to fight back, and we're able to protect our senior citizens a little bit more effectively. At the Detroit Police Department, the news continues to be very strong. Almost 900 Detroit police officers back at work as a result of the testing process. And maybe the most interesting thing of all, there was a time 2 weeks ago when we were quarantining another 100 officers a day. In the last 7 days, we've had a total of 7 new quarantines. That means out of a 2,500 person department, we've only been averaging 1 quarantine a day. That has a lot to do with Dr. Dunn and the medical guidance he's given us. It has a lot to do with the leadership of the Detroit Police Department that is committed now to the masks, to the temperature checks, to the testing, to the social distancing. We can go to work and control the spread of this if we do it correctly, and we're proving that right here in the city of Detroit. I invited some folks to come with me today, and so with me is, on the end, Erica Hill, who is the operations manager at one of the most successful drive-through testing sites in America out at the fairgrounds, and 2 of our unpaid volunteers. Day after day, Councilmember Roy McAllister and Councilmember Janae Ayers show up with their masks, they greet the cars. I am sure their constituents under the masks and the hats have no idea who they are. They haven't sought an ounce of publicity or credit for what they're doing, but they've been out there 10 hours a day in and day out, to help test Detroiters. And I wanted them to be here to emphasize that starting today, we have a major shift in our strategy. For the first time, we are testing without a prescription. It's only being done right now in the city of Detroit because we have the testing capacity. I've spent a good part of the day on the phone negotiating for more testing capacity. And so here's what we are doing. If you have symptoms and you're sick, you call your doctors. We've got the doctors listed. You don't have to have insurance. You don't have to have a car. We'll drive you. Every single Detroiter who's got any signs of symptoms can be tested tomorrow at the fairgrounds, and we are going to make sure that Detroiters always have first priority to make sure those who are sick can get in. But we have made so much progress that now we have at least 500 appointments a day available to people without symptoms. And we need to be able to have this city recover economically as quickly as possible. And so it's time to start testing people who don't have symptoms so people know for sure whether they're infected or whether they're not. And so city employees who have not been tested, who are still going to work, you can call today. We'll schedule you in. Eric Jones, the fire commissioner, is making sure right now that our firefighters who haven't been tested before are all being scheduled in right away. In addition to our employees, and our employees can call themselves, if you are working at any business in the city of Detroit that's an essential business that's open, you have to go to work. You can be tested, but your boss has to call. Your business owner or your store manager has to call and say, here's our company, here's how many employees we have, and we will get back and give you the days that those employees can come in. And we will say to you, it'll be Wednesday and Thursday, or it'll be Friday and Saturday. We will come back and give you a range. But if you're an employee at a private company, don't call the number yourself. It has to be the company itself that gets a code. And so encourage your employer to make that phone call, and in the next day or two, we will be calling those employers back and starting to schedule the times when you can come through as well. Finally, I want to thank Denise Starr and our HR team. We had about 2,400 employees, great majority of whom were put on furlough, uploaded to the state of Michigan on Saturday so people didn't have to file their own unemployment claims. A special thank you to Governor Whitmer and to Jeff Donofrio from the state of Michigan, who made that process very smooth for us. As you know, all of our full-time employees are keeping their health care. And I would say to every one of the 2,400 employees who has been furloughed right now, we want you back. We're going to bring you back as soon as we can, as soon as we start to come out of this. But for now, we want you to keep your health care. We want you to draw your unemployment benefits, keep your family healthy until we can bring you back. And with that, I want to turn it over to the folks who have been just doing an amazing job. I probably stop out there every couple of days And it is a marvel. You've seen places in this country where people have literally been in their cars 14, 16 hours waiting to get through a drive-through test site. I'd say the average wait time at our site has been 15 or 20 minutes. It has been a thing of beauty to watch. And so let me start with the woman who made it all possible, the operations manager, Erica Hill, to talk about what she's done and to introduce her two volunteers who are here to talk.
Thank you, Mr. Mayor. It would be remiss of me to say that I have done it all by myself, of course. I want to thank and show appreciation for the amazing team that is at the State Fairgrounds with Brad Dick and Melissa Leal and so many other people. Of course, I can't name names, but the team that was put together to ensure that the citizens of the city of Detroit are able to be tested timely and efficiently is amazing, and that goes from the security staff all the way to the operations folks. So clearly it's a team effort, and we wouldn't be able to do it without one another. What has happened at the State Fairground, as Mr. Mayor has said, is that it's been transformed into a very efficient operation for testing. And just to explain it very quickly, there is, of course, an entry gate, and then there are two checkpoints that vehicles come through. One is to just identify the individuals that are in the vehicles, and the second checkpoint passes the individuals or the clients in through the testing tent where they are tested. And as Mayor Duggan spoke, that all happens in about 15 to 20 minutes maximum. And the citizens never leave their cars. They're tested in their cars. They're treated with dignity, and they leave with the a sense of understanding about what's going to happen next. So we are very proud of the operation at the State Fairgrounds, and we are very, very well capable, as the mayor suggested, to receive the additional city employees and the business, the employees of all the businesses in the city of Detroit that are going to come through to be tested. And so I just want to reiterate that anyone can come through now and be tested, but you do need an appointment. So if you're a city employee and you need to be tested, you need to have an appointment. The phone number to call to have an appointment made is 313-230-0505. Again, that's 313-230-0505. And you can call that number and make an appointment. The hours of operation is 9 to 5, Monday through Friday. And you can receive an appointment anytime during that time. Those hours are open, and there is always going to be someone that is available to assist you. As the mayor also spoke, we have some amazing volunteers. We have staffed the location with not only general volunteers that have signed up online, but many of our city staff have come and committed their time to work at the State Fairgrounds. In addition to them, we also have our city council representatives, Councilman McAllister and Councilwoman Ayers, that have come out and faithfully served. And they stand outside. This happens outside, in the cold, in the snow, in the rain. No matter what the elements outside are doing, we're still there to make sure that our citizens can be tested. And so at this time, I'm going to hand it over to one of our pivotal volunteers who has been there outside. And as the mayor also spoke to, you probably wouldn't recognize him because he's busy manning traffic and making sure that folks are getting through the line efficiently. And that's Councilmember McAllister. So I want to thank you, Councilmember, and I'll turn it over to you.
Thank you, Supervisor Hill, and Mr. Mayor, thank you also. I want to reiterate what Ms. Hill has stated. This is a phenomenal testing site. The process goes so well, and I'm very encouraged that today we did have a spike. Normally, the volunteers out there get those cars down within 30 minutes. Today it took 45 minutes just to show what the spike was. But still, once they get that spike in, it takes about the most 4 minutes and the people are gone. It is an outstanding process that is going on, and it is very sanitized. I mean, it is the cleanest, I have to say, the area out there as far as masks, gloves, and sanitation. And this is very encouraging because not only does this help to reduce with the spread of this virus, but it also, I cannot reiterate enough that if we continue to wear our masks, continue to wear our gloves, continue to wash your hands, stay 6 feet apart from each other. These are the things that is going to help us, because it is not just those of us that are sitting at this table, those who are out at the site. It is each and every one of us that must come together and make sure that we tackle this coronavirus. So I just want to thank, and it's just, again, it is not nothing to have any type of recognition for. I'm just out here trying to do my part, as well as to assist in any way I can. If it's there or anywhere else, I am there, because we all have to come together and work together as a city to make sure that we tackle this. So again, I just want to thank Ms. Hill, Mr. Mayor for this, CEO Hakeem Berry, and several others that are out there, Brad Dick, Elise Melly, folks that are just out there that has just brought this together, as well as the healthcare people. I can't say enough about them. I mean, they're out there day in, day out, working with this. So I just have to thank everyone. Please come out. Please, again, I can't reiterate enough. Please, when you come out, make that appointment. Thank you so very much.
And Councilmember McAllister's right. Without Henry Ford DMC and Trinity Health, we could never have done that. They haven't asked for a dollar. They volunteered their time. And of course, Quicken Loans has made the appointment process move amazingly well. And now to our other volunteer, Councilmember Janae Ayers.
Thank you. Again, I think we've said it a lot today, and I don't think that we could ever say it enough. I think I wore the proper shirt today that says everybody versus COVID-19, because that's what it's going to take. It takes all of us. We've mentioned all the folks that are there at the State Fairgrounds, but I do want to reiterate that it's not just Detroiters that come through there. It literally is everyone. It's a regional activity. Detroiters take first priority, and so we want you to just take full advantage of being able to come without having a prescription. But again, to Ms. Hill's point and the mayor's point, please make the appointment. I personally want to give my condolences to the Herbert family. Ebby Herbert is a good friend of mine. And again, we all need to take the advantage, take the opportunity to get tested. So if you are working, and everybody is essential, but those that are on the front lines, know that we appreciate you, but we also want you all to get tested. So encourage your employer to call in so that you don't just arbitrarily show up and don't get serviced. And when you're out, if you're out getting your groceries or your prescriptions, just take a second to thank that cashier, thank the person that's bagging, because if it wasn't for them, we wouldn't be getting the supplies that we need. Again, I appreciate everybody that comes out. I didn't do any of this to be in front of this camera. Quite honestly, this makes me a little embarrassed. But I do it because it's the right thing to do, and it's right by my fellow man. And so if you are a person that can't come out, we appreciate you. Just pray for us. But I continue to be there because I know it's the right thing to do, and that is what I'm here for, to represent our entire city. So again, everybody versus COVID-19.
Thank you, Council Member. And our Health Director, Denise Fair.
Thank you. I first want to acknowledge Council Members Janae Ayers and Roy McAllister. I really appreciate you volunteering, and I think you're definitely right. It really is all hands on deck, and we are in this together. So again, thank you for volunteering. As of today, there are 7,736 confirmed COVID-19 cases and 629 deaths. My condolences go to all of those who's lost their loved ones and families. My heart especially goes out to the Herbert family and the loss of their 5-year-old child, Skylar. Today I want to talk about two things. I want to give an update on our website, on our new data on our dashboard, as well as give an update on where we are with the nursing home strategy. So on our website today, you will find a new dashboard in addition to the zip code analysis that I discussed on Friday. There is now a map that shows the case count by population of each zip code. So it's the number of cases per 100,000. So if you just go to detroitmi.gov/coronavirus, click on the box that says COVID-19 updates, you'll see two different dashboards. Again, one is the actual cases per zip code, and the second dashboard, which is side by side, is the rate of confirmed cases per 100,000. Because the team has to verify addresses, the zip code map will be updated twice a week to allow ample time for the verification process. I do want to take the time to acknowledge my team, the team of epidemiologists who are working really hard to get this data up and running, and that is Dr. Bezold and her entire team. They're really doing a phenomenal job gathering this information. All the data will be used to help us and to define and develop our strategies for additional outreach. So you'll hear more from me in the next couple of days. I'll switch gears now and talk about our nursing homes. And the mayor alluded to this earlier, but our seniors, those who are living in nursing homes, are continuing to get the support that they need from the Detroit Health Department in partnership with the City of Detroit, Fire, EMS, Wayne State, and also Henry Ford to help prevent and slow the spread of COVID-19. We have now administered over 1,000 tests, actually 1,038 tests to both nursing home residents and staff in 13 facilities. Again, this is part of a 10-day strategy. We have just a few more and we'll hit our target on Thursday. And it's really important that we start now because we know these nursing homes are in a communal setting where COVID-19 can easily spread. So not only are we testing staff and seniors, but we are providing PPE like masks and gloves to many of the facilities, the nursing homes who did not have access to these valuable life-saving resources. We continue to prioritize rapid testing because we know that seniors are often at a higher risk for these life-threatening symptoms from COVID-19. To date, we are now aware of 119 confirmed COVID-19 related deaths, again amongst seniors and staff in nursing homes with an infection rate of about 30%. We are taking this very seriously, so again, this is an aggressive time frame of hitting all 26 nursing homes by Thursday. Just this past weekend, Detroit was in the national news highlighted as an example of how effective and diligent social distancing can be to flatten the curve. So I do want to take this time to acknowledge all Detroiters who are taking this seriously. They're washing their hands, they're making sure they're 6 feet apart from each other. They are doing their part. So let's continue this. I know the numbers seem to be a little bit more encouraging as we're slowing the spread, but I ask that we again continue our vigilance towards, again, hand washing and staying home. With your help, I know we can achieve this. We have a little longer to go, but let's continue to fight the fight. And with that, I'll turn it back over to the mayor.
All right, anybody have any questions?
Good afternoon to you all. Mr. Mayor, have you increased the number of the 15-minute Abbott tests? I think you had 5 to start. 5 machines?
So I believe I have an agreement this morning to increase them, and as soon as Boise Jackson tells me, but I believe the CEO of Abbott and I reached a deal about 7:30 this morning. So
Stay tuned then.
yeah, so, but until our procurement department finalizes it, we are getting more machines. There are not more tests available yet because they haven't ramped up the production. But right now, Denise and her team are running those machines 18 hours a day. And we would like to be able to spread them out and ultimately do some mobile testing. And so, but we'll have an announcement on that, I suspect, in the next day or two.
Last quick question, just so that I'm clear. The expanded population or universe that you talked about today, I mean, you're saying that city employees and then employees at essential businesses it's opening up to them. Are they top priority? What if you don't fit that category?
So what it is right now we're saying 500 tests a day will be people who have doctor's prescriptions, and 500 a day will people without prescriptions who have to go to work because their employer says you're needed. Now, that's City of Detroit employees who are going to work, which certainly have a priority, but basically, if you work at Myers or Mike's Market or CVS or, I mean, you know who all these folks are who are out working every day. These men and women have to go to work in order to keep things moving for you. They haven't had the ability to get tested before. And so ultimately, I want everybody to be able to get tested regardless. But we have to go a step at a time. And now we're going into a major step of testing people without symptoms whose job requires them to leave the house, leave their shelter, and go out to work every day.
The exemption on the prescriptions, was that an ask of the state?
Again, I talked to Dr. Caldoun, and she's in full agreement with what we're doing, although she can speak for herself. But the state put a restriction on because there was a shortage of lab capacity. Detroit's just gone out and negotiated our own capacity. And so we made deals with Abbott, we made deals with BioReference in New Jersey. I expect to have another deal shortly. We are not taking away from any hospital, we're not taking away from the state labs. We're doing this on our own, and I do expect, if you look at what's happened in this city, we've just stayed away from the political drama, and we just go to work every day on the science. And that's what we've done. That's why to have Janae Ayers and Roy McAllister here, you haven't seen a word of drama out of them. They just show up every day and move the traffic through smoothly for an extremely successful drive-through testing site. This is what we're going to keep doing. We're just going to follow the science, and I expect that Detroit's going to lead the country in reopening our business, because we are going to reopen with the proper medical and science and not based on anybody's political position.
Mr. Mayor, my first concern is the homeless. The unions did such a great job, and I don't know if you've seen it, Councilwoman Ayers and Roy. They did an awesome job with building showers in Cobo Hall. And I went to some of the places that I feed homeless all the time. Some of them are not there. Is there a possibility that this could give us an awakening of what we could build for homeless, for showers and restrooms, for a future opportunity? Tragedy brought us to the point of watching it happen. Can we build from this and figure out some of these abandoned buildings, some of these apartment buildings, where we could build showers and maybe turn-in centers for them?
So I was just trying to look up the numbers while we sat here. Our outreach to the homeless community has been outstanding. Arthur Jemison and Donald Rencher from day one. Our nurses have been visiting at least twice a week every single person at our 30 warming shelters, our warming centers and homeless shelters, and isolating folks early on. And I was trying to find the number, but while we have a 30% infection rate in our nursing homes, it's under 10% in our homeless shelters because we have done so well. We do have a strategy, and it's called permanent supportive housing. We believe in moving to housing quickly, and so across from Reverend Holly's Church on Owens, we took that old St. Rita's and renovated it into permanent supportive housing. If you go over to Mack and Gratiot, where they're building a huge center for permanent supportive housing, the key ultimately is not to recycle folks through a shelter in the evening and kick them out at 8 in the morning to the street. In many cases, our homeless have got addiction issues, have mental health issues, had a real unfortunate turn in their lives, and need some kind of support, not just a bed for the night. While that's humane, the places that are succeeding are doing the permanent supportive housing. And we have built many permanent supportive housing units. We're building many more right now. I think the speed which with our housing department moved to get medical care to the homeless, and the way we protected them. If you had started off and said you'd have a minimal infection rate among the homeless and a high infection rate in nursing homes, I don't think people would have predicted that. But instead, we've done, I think, a very good job with the homeless, and we're going to continue to pursue the strategy.
And since you're at large, you think it could be one of the tasks that we could work on in terms of not only, and you're right, Mr. Mayor, you can't just put somebody in the house and they got a mental issue, they got other issues, and now you got a whole nother domestic violence situation. But Ms. Ayers, I know I've been with you at more than one occasion when your concern was there. What would be your springboard from this? Because whatever God does, God allows. But what do we do with it is the issue. I guess, and then I want to ask about the buses to you, Mr. Mayor. But go ahead.
So thank you for that. And so let me start at the first part. I do want to thank Plumbers Local 98 for the work that they did do inside of TCF Center. So that's number one. But to your point, I think what we've noticed in this entire pandemic is that we have to find creative ways to start doing some things. And so I can't give you an assurance to say that, what we've modeled right now in a time of crisis is what we'll be able to go forward and do wholeheartedly. But I can tell you this, looking at just some of the ingenuity that people have come up with and ways that we know we can move, I think that this gives us a place to kind of make it as a springboard. And I look forward to when the world comes back to being a normal world, we start having better and more creative, deep thought conversations. So we'll keep you posted.
And I've had many of my readers call me for the Shot News saying, I ride the bus. What are we going to do about monitoring people with the mask? I don't ride the bus, thank God. Roy, me and you don't ride the bus. But what do we do for those people who ride the bus, who we're going to see the next day or later that day or whatever? And maybe you could say it as the councilman, then the mayor. I mean, I just got a lot of calls regarding people saying they're getting on the bus and people are still not masked. And y'all only put masks out in the morning. If you ride the bus in the afternoon, there's none there. Have that been brought up, and what would be the resolution, and how do we get people to realize that we need to have a team? I just was on a radio national show in Chicago. They doing for the brothers, mask up, save a life. And maybe we need to start something like that, mask up, save a life. And if we can get some regular people that could be funded instead of some of the favorite people be funded, we can reach the people, Mr. Mayor. Giving Master Wendell Anthony with a certain pool, love, respect him, love his church, respect him, but there's other groups of people that don't get touched when we get those favorite pastors and favorite community organizations, because there's a whole nother community that this thing can affect all of us. So if I would like to have Roy follow up on what can we do in a community where all these people drive on the bus and then end up in a church with us, end up with us at a community center. And then, Mr. Mayor, if you can follow up after that, what do we do in order to make sure that people know where the mask can be gotten, or even have we ran out?
Well, first of all, I do ride the bus because it is a concern as far as how this is being addressed. And speaking with the mayor and the administration, there are things that are being put in place. They are putting masks on the buses so that people, when they get on the bus, they have the availability of a mask. So those are things, as Member Ayers has stated, everyone is coming up with ideas and everything. We're putting everything in place. So it is something that we are working on. In fact, when you talk about the mass transportation or the DDOT transportation, that's where some of the people that we can find and hopefully can educate as far as how this issue needs to be taken seriously, because they're riding the bus, they have to get to their locations, and we must make sure that they are masked so that we're doing that. And one other thing I like to say is, I chair the mental health task force. So that's another thing that we're looking at, because there are so many issues that are happening with that. I always say that mental health is life. And this crisis, this pandemic now, is changing the life of a lot of people. And a lot of things that people are going through, it is because of the pandemic. So those are also things that I'm working on, is how do we help people to address their concerns and their issues. So with that, there are things that are being incorporated, because we're looking at every avenue, every person, because again, I can't say it enough. All of us need to come together and work on this thing together to fight this coronavirus. And if we do that, then we will. So we are doing that.
And Mr. Mayor, this is my last. When you answer, can we figure out a way to talk to our congresspeople and make sure that in the next bill that there is a bill, so your budget director or whoever is not worried about a budget versus saving the people. We should be able to get masks and y'all get reimbursed from the government. It's just a suggestion.
So let me start with this. I've been talking to our congresspeople, and they've been fighting very hard. I certainly support the elements that are coming together in Washington right now to extend the payroll protection plan, because you've got a number of companies in America and in Detroit that did not get covered before the money ran out the first time, and that's paychecks for a lot of people in this town. The last update I got from our delegation 3 hours ago was that it looked like there wasn't going to be money for local government in this one. But you can't stop the good things because you don't get everything. And so our congressional delegation has done a great job fighting for us. As far as the masks go, we have masks. And I had not heard that there were masks missing in the afternoon. I'm going to call Glenn Tolbert, the ATU union president, when I get out of here, but there's no reason that we aren't resupplying those masks on the buses in the afternoon. And right now, we're actually having conversations about how do we distribute masks potentially at grocery stores so people wear them as they go in. What about funeral homes, where Council President Brenda Jones has asked us to look to make sure that there are masks at funeral homes, and we lose sight of this. We found this out with the nursing homes, and it surprised us. The hospitals are big entities. They're actually doing a pretty good job of buying this stuff now. A few weeks ago, it was a lot worse. The city is really good at buying it. A lot of these small outfits don't know where to go for the personal protection equipment. And so Lawrence Garcia, our corporation counsel, has taken it on himself to lead the distribution. And the city is going to more and more try to acquire masks and cleaning equipment and the like for those kinds of small businesses that need it. And I'm going to find out about the afternoon buses. I had not heard that, but I'm going to check.
Well, thank you, Mr. Mayor. And one more point. I have at least 20 pastors on here that's giving me First Institution, a whole lot of churches saying there would gladly be a spot where you could distribute. So let's be fair with, when we get it, that more than just a couple of people that we always see being it. I don't want to start naming names, but Pastor Moore just in First Institution just put it on here about 12 times. And 7 Mile and Southfield is a long way from downtown.
Pastor Moore is my friend, so
Yeah.
if he knows the place.
She, Robin Moore.
Oh, this is the other one. Okay. But what we're trying to do is figure out where is a place where people go where they're going to interact with other people. So if you think about it, as you go onto the
And
bus,
safe.
we don't want you breathing on other people. You go into a grocery store, we don't want you breathing on other people. If you go into a funeral home, we don't want to. And so what we are trying to do with the masks now is reach out to those businesses that cater to customers who could be breathing on other people. That's what we're working on doing right now, and we're going to keep trying to do that. Again, this is not politics, this is science. We are looking at where is the most likely sources of spread, and we're trying to control that spread, and that's why you see a national briefing by the head of the President's Task Force say Detroit has been, she said, incredible in bending the curve. We're just going to stick to the science and do the right thing.
Thank you, Mr.
Okay.
Good afternoon, everyone. Jim Kurtzner with Channel 7. Just to clarify one thing, apparently there's some confusion now. Could you clarify who needs the prescription to be tested out at the fairgrounds?
So this is very simple. Any person who has symptoms, any person in the city has symptoms, call your doctor. If you don't have a doctor, go to our website and call the doctor. You'll get a prescription, you can get tested, period. If you don't have symptoms, but your job forces you to leave your house and go to work, your employer can call and you can get tested even if you don't have symptoms. So anybody with symptoms can get tested. Anybody whose job makes them go to work can get tested without a prescription. Is that clear?
Yeah, I think so.
Okay.
A follow-up question to that. I have not heard you discuss so far what a lot of people are discussing nationally now, and that is the contact tracing.
Right.
Do you have enough people to do the contact tracing out at the fairgrounds when someone is tested positive? Do you have enough personnel to do that yet?
There's no contact tracing going on in Michigan or in most places in America right now. So here's what contact tracing does for you. If you catch it early and you've got 6 or 8 or 10 or 12 people infected, you can have health department staff run them down, find out who they had contact with, them, isolate them quickly, get them tested quickly. When you're at a point now where you have 7,000 infected people confirmed in the city, and we easily have double that, it doesn't necessarily do a lot of good today. However, contact tracing is going to be important in the not too distant future. When we start to open up a business and people go back to work and you're testing regularly, and one person in that business tests positive, now we've got it under control. You will immediately contact trace. And one of the things that is going to be an important piece of reopening business is going to be a vibrant contact tracing program, and we're working on building that up right now.
I believe they said Massachusetts is hiring 1,000 people for that job?
So this is how, when it goes down, you keep it down. And there's no doubt we're going to end up hiring. We're talking to the CDC right now about them potentially lending us some folks to do it. But it is not something that is a focal point right now. It will become a focal point in the not-too-distant future.
Also, a follow-up to the nursing home question. We are getting contacted at the station by frustrated people in the city, in the suburbs, about the nursing homes being hot spots. There were a couple of stories a week and a half ago that there was a nursing home down in Riverview that had 7 deaths, another one in Livonia that had 14 deaths. When you're talking about I believe the number was 222 deaths of seniors out of the 629 in the city. Are you identifying how many deaths at each nursing home? And
Yes.
if you are you releasing that to the public?
Yes. We're not releasing it publicly yet. We will. I mean, at some point, the state will decide whether to release what in what places. But right now, what we are doing is dealing with the problem. And so here's a situation that you had at nursing homes across the state, and a problem, honestly, they've still got in the suburban nursing homes, is as I've talked to before, we have about 30% of our people in the nursing homes have tested positive. It's about 30% of those who had symptoms, and it's about 30% of those who didn't have symptoms. Now imagine you are running a nursing home, and you are trying to decide how to separate the seniors in your home, and you can't get a test back for 4 or 5 days, which has been the standard in this state. By the time you get that test back 4 or 5 days later, who's infected and who's not is almost ancient history. And so what's happening in Detroit, and I never envisioned this, when I started with these 50-minute tests, I intended to do entirely police, fire, DDOT. We did test 1,000 cops, and we tested several hundred firefighters and DDOT employees. But when we realized the death rate we had, and we realized the nursing homes had no way of promptly isolating the infectious from the non-infectious, we shifted gears. And so we are now giving the Detroit nursing homes the ability to make an informed and sound medical decision. But it shows you how crippled this country has been with the lack of timely testing. 4 and 5 day turnarounds for an immediate problem is just not sufficient.
Having said that, what does it take to notify families and notify the general public that a certain nursing home is hotter than a hot spot?
We'd have to talk to Dr. Caldoun about that.
Do you believe it should be done?
Again, I don't want to give you an answer on something I don't know. The city of Detroit does not regulate nursing homes. So it's not my position to decide what should be released when, but when they are Detroit residents, as far as I'm concerned, it's our job to protect them. The regulation, you're going to have to talk to the appropriate state officials about, and I don't have any problem releasing all information. I just don't know that it's our call to do it.
Because if you're the family with a loved one in there and you don't necessarily get the call from the nursing home, the only conduit of that information could be the city.
Yeah. No, I understand what you're saying.
Mayor, we do have a few questions from other reporters who are watching remotely today. WWJ wanted to know if you've had any conversations with the governor as far as what types of businesses might be first to open or reopen.
Yeah, we've had a number of conversations.
Okay. Also, along those lines, Cranes wants to know that you'd mentioned that you want Detroit to be a leader nationally in terms of developing a plan and reopening businesses in the community. They want to know if you've got a plan in place yet or if it's still in development.
So we are very intensely working on it, and we're going to start with City of Detroit operations. No City of Detroit operation is going to open without a medical sign-off on the protocols. So right now I'm focused on that. Once you see city operations open with the proper medical protocols, I think it'll be a roadmap for a lot of business folks. But right now, there is a whole team at the city. It's got to be 20 people. But it is very different. the people who cut the lawn and the people who repair the roads are very different than the people who might be serving those paying their taxes at the windows on the first floor, or those passing out permits on the fourth floor. Every single, those going in for administrative hearings, on tickets, every single setting in city government is different. And everything will be opened up on a different timetable. Some might be opened in May, some may not be open till August. But what is going to happen is we are going to open them when the doctors have signed off that we have a medically safe way of operating. I've said this before. I go to work every day on the 11th floor of City Hall, and the handful of people who are with me, we are operating on very strict medical protocols. The Detroit police go to work every day, and they're operating on very strict medical protocols, and that's succeeding. And we're just going to keep working on making sure every single operation is medically safe, and we'll go from there.
Okay, WDET wants to know, they've been hearing of more reports of EMS personnel or police finding individuals who are, quote, dead on scene, and they're wondering if we think that some of these may be COVID-related deaths, or if we're looking into that and what that means for our numbers.
You know, I haven't looked at those statistics.
Okay, another question from WDET is, as it gets to to essential businesses, reporters and other members of the media, how would they fall into that, or how can they find out?
If you have to go to work for your job, you can call in. If you are on TV every night from home, you don't get to come in. So this is a very simple rule. If your job requires you to leave your house and go to a workplace, you are being exposed to more people because you're out serving other people. Those are the folks who get priority, and TV folks count just the same as everybody else.
Okay. Question for our city council members. Detroit Free Press wants to know if city council may be following the mayor's plan for reducing personnel costs by implementing work share or some other form of that on city council with your staffs.
Well, I'll address it first. I don't think that it is beyond us to know that this is impacting everyone. And so we have to make the same type of decisions when it comes to our teams. I know for myself, I've spoken with my team along the way so that they understand what is happening and the way that we're going to have to feel the brunt of this just like everybody else in the city. What I've personally decided to do is to make sure that my team is on work share. I think it's the most prudent and I think it's the most responsible thing to do with my team. And I made that decision not, without any thought. This will allow for them to capitalize on as much money that is available for them, and that is what it will be until July 31st, at which time, prior to July 31st, we'll examine. Maybe some will come back full-time. We'll figure it out depending on where we are as a state, as a country. But I'm going to always do what I think is best for my team because they do what's best for me.
And with that, work share is only one of the avenues. We're trying to look at as many avenues as we possibly can to make sure that this budget is balanced and that we can continue to move on to make sure that we are giving services to our constituents, the people in the city of Detroit. So it's just not just one avenue that we're looking at. We're looking at a number of avenues on my behalf as far as how we can make sure that, again, everybody is working together and everybody continues to receive service.
Thank you. A couple of other follow-up questions. Even with the city's success in flattening the curve, Christine Ferretti from the Detroit News saying that there's still social media chatter, et cetera, showing people who are congregating when they shouldn't be, and wants to know if we're still considering, or if we may consider the possibility of a curfew or closing parks.
The Detroit Police Department has indicated to me they don't see any need for that. And what you're seeing over and over is that every time people in this town start to congregate, neighbors are calling the police are there, they're breaking it up. I think everybody understands that now. If that changes, we'll revise it, but the police commanders have been emphatic with me that the cooperation level in the city is extremely high. But this is the difference between perception when you sit at home and look at a report on social media and when you're out in the streets of the city. This city has been phenomenally cooperative. 99% of the people in this city have taken this very seriously and have been very quick to call on those who don't, which is why Dr. Burke singled out Detroit out of all cities in the country. She's not going off a random social media post, she's going off our hard data. And hard data is the 700,000 people in the city of Detroit have been great.
And a couple of questions from Bridge Magazine. I think a couple of them already have been addressed, but they're wanting to know how many currently are we testing each day at the state fairgrounds, and with the shift to testing the non-essentials, to clarify whether there's any additional cost to that or if it's just using the additional.
It's the same. So we have had testing capacity to do 1,000 a day at the fairgrounds and about 300 a day on the 50-minute test. So we got capacity to do 1,300 tests a day, which, as I say, is probably at least a third of the testing being done in the state of Michigan. As I was really glad to see some of the suburban drive-through sites open up. And so we had a lot of suburbanites who were coming through the fairgrounds, and we were glad to accommodate them. Now that suburban traffic is going off to the suburban drive-through sites, and it opened up new capacity. So it's not costing us anymore. It just means that we're taking 500 appointments a day that would have been given to folks who had prescriptions. Now we don't need that many. They're now being used to workers who have to go to work who don't have prescriptions.
Okay, and just one final follow-up from ML Elric at the Free Press for Councilman McAllister. I just wanted to get some clarity in terms of whether or not you were supportive of some kind of a staff reduction or the work share.
Well, again, you know, we're looking at all avenues because that might be one, but it's just a factor of how many other avenues can it be. The overall objective is to make sure that we continue our services to the best, as much as we possibly can, and still provide services to our constituents. So, you know, you can't answer it by one specific area because there's a number of things. Just like with this coronavirus, there's a number of areas we have to look at and make sure that we address.
Okay, no further questions.
Anything else? Thank you all very much.